Oh, how's everybody doing today? In today's medical mnemonic video, I'm going to go over beta blocker contraindications. As an overview of beta blockers, we know that beta blockers, they block the beta 1 receptors and the beta 2 receptors. The beta 1 receptors are located predominantly in the heart and the kidneys, and they regulate your heart rate, your renin release, and also cardiac contractility. As for the beta 2 receptors, they're located in the lungs, liver, pancreas, and arterial smooth muscle. Those are the two receptors that beta blockers act on. And I'm just going to go over some of the contraindications to taking beta blockers. And also, beta blockers, just as another review, they reduce blood pressure, and they do this by blocking central and peripheral beta receptors, okay, which results in decreased cardiac output and sympathetic outflow. So the mnemonic is A, B, C, D, E. Very simple, easy mnemonic. And these are, again, going to be the contraindications. So the first one, the A, is asthma. So beta blockers are contraindicated in patients who have asthma, specifically non-cardioselective beta blockers. As we look back, those act on the beta 2 receptors, and actually the non-cardioselective act on both beta 1 and beta 2. And the beta 2 are the receptors that are located in the lungs, which can cause issues for patients with asthma. B is for block or heart block, and more specifically, second or third degree heart block. So if a patient has a second or third degree heart block, beta blockers are contraindicated. C is for COPD. The D is for diabetes mellitus. If you have a patient who has diabetes and they are taking a beta blocker, this can mask the symptoms, the signs and symptoms of hypoglycemia. So unless they're checking their blood sugar on a regular basis, they could have very low blood sugar and not even know it. And the last one is the E, which is electrolyte imbalance, specifically if a patient has hyperkalemia, that is contraindicated to take beta blockers. And as a side note, the antidote for beta blocker overdose is glucagon. So with that said, I always like to tie in a Mnemonic that I like to use. One of the Mnemonics that I just recently watched is Cardiovascular Effects of Beta Blockers. Mnemonic has several different videos on beta blockers. So if you want to get a good review on beta blockers and specific beta blockers, they have that all here on Mnemonic. So anyway, that's today's medical mnemonic. Tell me what you think in the comments, and tell me some other topics or some other mnemonics, if you have trouble remembering certain things, because I know mnemonics help me tremendously in nurse practitioner school. Anyway, y'all have a great day. Thank you for